talk about today, and let me just set my timer, please. 1 second, give me a minute. So that, right. So what I'm going to talk about is pregnancy is obviously a very, very common thing. And particularly in India, I don't think we can get over the fact that we are producing the largest number of babies in the world. But the thing is, you can't just get into pregnancy without having any thoughts, and you must take charge of your health when you are pregnant. And this ultimately has far-reaching consequences. It has amazing effect on the baby. So the first thing that you have to do before getting pregnant is thinking about pre-pregnancy counseling. And why is this very important? I always believe that there should be no unintended pregnancy. You know, what I call the oops pregnancy. Oops, I'm pregnant. I don't think that should ever happen. I think women, particularly educated women, particularly women who have a life plan for themselves, should go through this whole process of thinking before pregnancy, planning a pregnancy. And this is important because you go meet your doctor, you go through a whole set of tests and investigations, or more importantly, even just talking to the doctor and bringing out your concerns and deciding what you should be doing next before you get pregnant. And this is part of taking charge of your own pregnancy. Even before you get pregnant, you have already decided that this is going to be a pregnancy that I have planned, that I want it to go well, and I'm going to do everything in my means to be able to do that. One of the most important things, and in India, when we grew up, famine was a reality, starvation was a reality across the country. But now 1 out of 5 women in this country are obese. So we also are facing this huge problem with obesity, overweight. And so pre-pregnancy counseling, the first thing, one of the most important things is that you have to look at your weight. You start off with what is your weight even before you get pregnant. Try to optimize your weight, and I'll talk to you later on in this talk about how important that is. So first thing that you have to do in your pre-pregnancy counseling is meet your doctor for your height. What should your weight be, and how do you optimize it? You have to check for high blood pressure. You know that in India, we have one of the largest caseloads of high blood pressure, diabetes. So you have, especially if you have a family history, meet your doctor, make sure that, you know, if you are already have high blood pressure, then check and see what tablets you should be taking. Or if there's a family history, then there's an increased risk of getting high blood pressure during pregnancy. So then you figure out how you can plan your pregnancy, so that you can avoid high blood pressure in pregnancy, diabetes in pregnancy, and most importantly, start on folic acid. Now, folic acid is also known as the engagement drug. That is, when you get engaged, you start on folic acid. Why is it? Because we know that this particular vitamin is very, very important in avoiding certain abnormalities in the baby, especially spinal cord defects. And so it's important that you start folic acid, because you should be on it for at least about 3 months before you even attempt a pregnancy. So it's not that you shouldn't, if you have not had folic acid, it's going to harm the baby, but certainly a certain amount of folic acid, increasing your level, keeping it at the right level, will make a big difference for your baby and your baby's health. And then you should read whatever you can and find out and know about your pregnancy. Now, this is a miracle when 2 cells, the ovum, the egg from the woman, and the sperm from the man, when fertilization happens, it's really a miracle. You take just 2 cells, and then it produces a human being made up of billions of cells, which can do everything. We can talk and sing and speak and dance and breathe and smell. I mean, it's just amazing what these 2 little cells can do. And it's a miracle. There's no question about it. But just before we go on, I just have to say this little thing for people who already are mothers or have been mothers for a long time, and or mother who have been married for a long time. This is something I just want to, because a miracle is fantastic, the baby is great. After a while, certain things happen, and then as the babies grow up, you have to set it free, because one of the biggest things, the best thing that you can do for your children is let them go, let them roam, let them find what they can do. So if you love something, set it free. If it comes back, it was and always be yours. You don't have to cling on to your children. But if it just sits in your living room, messes up your stuff, eats your food, uses your telephone, takes your money, and never seems to know that it actually was set free in the first place, you either married it or gave birth to it. Okay, so this is just for all the mothers who already are there and wondering when your babies are going to leave the nest. This is just a little thought for you. Okay, before we actually go on to the other things in pregnancy, I think the most important thing is eating healthy in pregnancy, because the minute you get pregnancy, your mother-in-law, your next door neighbor, pakate aatu mami, everybody gets into this thing about frenzy, about start eating, you're eating for two. And women just let go of everything and say, yes, now I can eat. But eating healthy in pregnancy, I think this is a focus which has been a focus of my practice for years, for decades. I always told women, know your weight at the beginning of the pregnancy. We used to always calculate the BMI, tell the mother, okay, your BMI, your body mass index is so much, you can only put on so much during a pregnancy. If you started off with a normal weight, you cannot put on more than 10 kilos in a pregnancy. And to do that, make sure that your food is very balanced, and a lot of it has to be plant-based. And I think that is something that everybody should get this message across. Plant-based food is excellent for you. It's basically, I'm not saying become a vegetarian. I'm not a vegetarian, but plant-based food is very good, particularly in pregnancy. And eating for a healthy pregnancy, I think there are certain things that I truly believe in. And I will come more to the rules of two, but 2 glasses of milk, 2 cups of curds, 2 katoris of vegetables, 2 katoris of fruit or 2 fruits. If it happens to be bananas, maybe you can have 1 banana, 1 guava, 2 cups of sundal every day. And I believe that is such a good source of protein. So that gives you, and it also keeps you full. You're not eating junk food. You're not eating other stuff just because you're hungry. And drink lots and lots. There you don't stop with 2 glasses of water. You have lots and lots of water. Hydration, especially in a place like Chennai or in Tamil Nadu, where we are hot and sweating all the time. Keep yourself hydrated. And it's extremely important. Everybody talks about carbs, right? For everybody, leave alone pregnant women. Carbs are very, very important, and it's something that we have to pay attention to. Okay, the moment you talk about carbs, everybody gets into this argument. Should we be eating rice? Should we be eating chapatis? I remember one patient who came in, and she was putting on 2 to 3 kilos every checkup. And I was just going nuts, because I was trying to figure out what was happening. We've been giving her advice on not to eat too much. And her mother sat next to her and says, "Onnume sapradilla, madam." I said, "Onnume saprade, epdipa 3 kilos yerudhu?" She said, no. Sadame sapradilla. So going through this complete, like a detective, sadam sapradilla, how is she putting on weight? So I said, "Appo karthala enna dhaan sapradhu?" "Oru 4-5 dosa dhaan sapradhu." அப்புறம் மத்தியானத்துக்கு வெறும் இட்லி தான் மேடம், சாதமே சாப்பிடுறது இல்லை. அண்ட் தென் ராத்திரி அதே தான் மேடம், மத்தியானம் இட்லி சாப்பிட்டுச்சுன்னா ராத்திரி சப்பாத்தி, ராத்திரி தோசை. I said, எல்லாமே சாதம் தானேம்மா. So that your concept of rice is bowls of rice, big mounds of rice on your food, on your plate, and definitely not. I think moderation. If you're going to have rice, have it once a day if you're talking cooked rice, and have it for lunch, because you don't want to eat very heavy at night. And you have 2 cups of small katoris of rice. Fill yourself up with sambar, vegetables, all the other things that you're going to have. And when it comes to chapatis also, it's not like if you eat chapatis, you're not eating carbs. It's the same thing. It's the rule of two. You have two chapatis. You can't have a basket full of chapatis in front of you, watch TV and eat them. And somebody saying, oh, you're pregnant, please have two more, have two more. So rules of two is not two more, it's only two. You stop with two, okay? So that's important. And idlis, oh my God, the number of times I've asked people, how many idlis do you have? And they only say, nalanji dan, anjar dan, Ariyar dan. And the dan, it used to drive me nuts, because really you can't have more than two idlis. You cannot and should not have more than two idlis. They'll say, romba chinna idli, pressure cooker idli. But basically it's idli, it's carbs. Okay, it's very good. It's a good food, but certainly you can't be eating that much, that many calories. Have two idlis, fill yourself with the sambar, have some fruit, have a glass of milk. So that's important. Okay, rule of two. Proteins are very, very important, because that's what builds up your muscle. It builds up the baby's muscle. It's the building block of the baby. So definitely important. And for vegetarians, the lentils are very important. Have sundal, you can have a chana, you can have any amount. Non-vegetarians can have meat and eggs. Eggs are, I think, a perfect food. It's protein. The white of it is protein. The yellow, the yolk is good cholesterol. So certainly you can eat all this, and it's very, very, very good for you, right? One question that comes up all the time, how much caffeine can I have? Can I have tea? Can I have coffee? Because everybody, especially your aunt sitting in Canada, will phone you up and say, stop, don't drink coffee. You're pregnant, So each one is giving you all these ideas, but basically you can have less than 200 grams of caffeine per day, which comes to about 2 cups. You can have a cup of coffee in the morning, or you can have a cup of tea in the evening. Either way, 2 cups of either coffee or tea are perfectly okay. It will not harm the baby. It's perfectly okay, right? But there are certain things you absolutely have to say no to, okay? And I know there are going to be lots of people watching who are going to say, oh my God, this is a horrible doctor. She says no chocolates, no cakes, no sweets. Oh my goodness. Yes, because I truly believe that sugar is bad for you. And this is a theory that everybody talks about. Keep less of white stuff on your plate, less white rice, less white sugar, less white salt, cut it down. I mean, once in a while is fine, but the thing is, sugar is addictive. Do not forget that, okay? And I have stayed away from sugar for a long time, and I'm not a diabetic. It's not because of that. I just feel it's not good for your body. And when it comes to alcohol, it is a complete no-no. You might have a chocolate once in a while, but you cannot have alcohol, because it can cause fetal alcohol syndrome, and that can be very, very dangerous for the baby. So absolutely no question of young girls who want to have a glass of wine, who want to have a beer, whatever, that's fine if you're not pregnant, okay? So that's absolutely a no-no, right? Supplements. Absolutely one of the important things, because you cannot get enough iron and enough calcium from your diet. You need iron, and if you're looking at iron, please make sure that your iron supplement says that it has at least 60 milligrams of elemental iron. That word will be on your bottle of iron. You should have at least 60 milligrams of elemental iron. Folic acid, anywhere more than 1 milligram, 0.4 milligrams actually, but anything more than 1 milligram is fine. That's all you really require, unless you've had a baby with a problem before, where your doctor herself or himself will put you on 4 milligrams or 5 milligrams of folic acid. And get a combination where iron, folic acid, B complex is there. And listen to me, just buy the cheapest one. You don't have to buy something which costs 13 rupees and 18 rupees a capsule. They're absolutely of no use. Take the cheapest one, 1 rupee, 2 rupee, 3 rupee iron capsules. They will work fine as long as it's ferrous sulfate or ferrous fumarate, it'll be fine. Calcium, if you're a good person who has been taking a good amount of milk and curds through your life from the time you were a child, you probably are not calcium deficient. But if you have not, then calcium is necessary. We know that the baby uses up the calcium in the mother. So calcium about 500 milligrams a day, and usually it comes with vitamin D. So you get the combination. So those two things are very important. And if somebody tells you, take something with DHA, okay? DHA is found in salmon and it's found in tuna. Those kind of fish, we can't even access. So I know that Ramanujam, the very famous mathematician, his mother was a pure vegetarian, okay? She never had fish in her life, but she had a genius. So you don't have to have DHA. There is no evidence. So don't buy things which have DHA because it just increases the cost of the tablet. Staying fit in pregnancy, again, one of my absolute important things that I have pushed throughout my career. You have to stay fit in pregnancy because that is what's going to make sure that your pregnancy goes well, your baby grows well. The other problem is that we know that women who are overweight or obese have increased risk of miscarriage, have an increased risk of developing diabetes in pregnancy, have an increased risk of getting high blood pressure in pregnancy, and have an increased risk of having cesarean section during pregnancy, end up with a cesarean section. So it's so important to stay fit and you will feel better. And the best way of avoiding this issue, a fat baby, an obese baby. Everybody will say, oh, it's a chubby baby, but this baby is going to face problems later on in life. It's going to have struggle with adult obesity. It'll struggle with diabetes, hypertension later on in life. So you don't want to have one of these so-called chubby babies or super big babies. Okay. So the best way to stay fit is walking. I believe so much in walking for everybody, leave alone pregnancy. I think walking is the best exercise in the world. 45 minutes of brisk walking, not a stroll, okay? Not just a tiny little stroll where people are thinking you're walking along thinking great thoughts. No, you should be looking like you're running to catch a bus. You should be walking really, really fast. We used to run a passport to fitness as part of our obstetric care. We used to have a trainer working with our pregnant women. So if you can join a pregnancy antenatal class, I think it's fantastic. Nothing like it. The biggest question that women have about their pregnancy is, how is my baby doing, right? What is the baby doing? How is it growing? And I think one of the best things that has happened in the past 4 decades is ultrasound. And ultrasound gives us a window into our baby. And here's a baby about 8 to 10 weeks, which is moving around. So we can look at the baby, we can see how it is formed, you can see the spinal column, you can see so many things. You can do a 3D ultrasound, which gives us a much better visualization of the baby. And most importantly, we screen for Down syndrome, which is the greatest reason for intellectual disability in babies. So screening for Down syndrome is very important and it should be done. Labor and delivery, the husband, I believe, should be there helping the mother. It can be, just remember that there are breathing exercises you can do in pregnancy. You can make labor much, much easier than what our mothers and grandmothers went through, because the end result is always going to be very beautiful. But you can talk to your obstetrician earlier, try to talk to them about a painless delivery. Epidurals are available, certainly in the urban areas. So you can talk to them about it. And something that women always worry about, will I have a normal delivery? Will I have a cesarean section? And the one thing that you must do, and I believe, is staying fit is going to help you avoid a cesarean. Have a conversation with the obstetrician. Make sure that they know, she knows, that you absolutely are willing to go through anything to have a normal delivery. And most importantly, choose the right hospital. See what their cesarean section rates are. Ask them. I don't think any hospital should have a cesarean section rate more than 25%. And I think this is your right to find out from the hospital what is a cesarean section rate. Role of the father is extremely important. He should be involved in the pregnancy right from the beginning, going with the mother to the obstetrician. They're very good for giving massages. Okay, that's one of the great reasons to have your husband around when you're pregnant, for head massages, back massages, everything. They certainly have a role to play in pregnancy. We've allowed husbands in the labor room from 1981. It is so important to have your partner there and help you to go through it. And of course, right from the minute the baby is born, the father is bonding with the baby and plays a very, very important role in the growth of the baby. The last thing I'm going to talk about is pregnancy in the time of the COVID-19 pandemic, because everybody is concerned about it. The only good thing about this pandemic is that COVID-19 does not seem to harm mothers or their babies. And this is very important. From the data that we have till now, H1N1 flu, that is the swine flu was extremely dangerous for pregnant mothers, but COVID doesn't seem to have that issue. Babies are also coming out without any problems. So that is the one good news in this era of COVID-19. Thank you so much. I really, really enjoyed speaking to all of you. And I think Shanti will allow some questions at